So transparent plastic strips are employed as a matrices for tooth color restoration. They allow the light to pass through them during polymerization of composite resin. Next is there can be different strips types: celluloid, cellular nitride strips used for the silicate cement, cellophone, cellulose acetate used for the resins, mylar strips used for the composite and silicate restoration. Matrices inserting after inserting the composite resin material, the matrix is pulled tightly around the tooth, following which light curing is done. Indication है for class 3 and class 4 tooth color restoration advantage क्या है कि ease of use and inexpensive. So next one is window matrix. Modification of Toffelmeier matrix used for class 5 amalgam restoration. The contra-angle Toffelmeier retainer is applied on the lingual side of the tooth. A window is cut in a bend slightly smaller than the outline of the cavity. Wedges are placed interproximally to stabilize the band. Following this, amalgam can be condensed through the windows of contour using carver. Next is wedges. Wedges are devices that create rapid separation during the tooth preparation and restoration. Wedges are small tapering triangular piece of wood or clear plastic about one inches in length. See the diagram. Function of wedges: help in rapid separation of teeth, prevent gingival overhang of the restoration, provide space to compensate the thickness of matrix band, help in stabilization of retainer and matrix during restorative procedure, help in retracting the depressing the interproximal gingival area, thus help in minimizing trauma to soft tissue, help in depressing rubber dam in the interproximal area. So see the chart. Wedges जो होते हैं वो वुडन होते हैं, प्लास्टिक होते हैं. नेक्स्ट इज वुडन में भी triangular and round, and plastic में light transmitted. So first is wooden wedges. Soft wood like pin or hardwood like oak, they may be medicated. They are preferred because easily trimmed, adapt well, absorb moisture and soil to provide adequate stabilization to metal span. They are used along with the metal matrices. Plastic wedges commercially available, used with the either transparent matrices or metal matrices. They can be trimmed, thus cannot be custom fit. Special plastic wedges which are transparent and have a light reflecting core, used with the transparent matrices. While placing class 2 composite restoration transmit 90 to 90% incident light. That it helps in reducing the polymerization shrinkage, and it transmitted light better adaptability. Next, placement and location of wedges. So correct location of the wedges in the gingival embrasure below the contact area. Select the appropriate wedge depending on the clinical situation. Wooden wedges can be trimmed with a knife or scalpel to produce a custom fit. Wedge is usually placed from the lingual embrasure, which is normally larger in size. If it interferes with the tongue, it can be placed from the buccal side. So length of the wedge should be only 0.5 to 1.3 centimeter, so that it does not irritate tongue or the chip. After placement, wedge should be firm and stable. See the diagram. Next one. So place as a near to gingiva cavo surface margin as possible, not only for stabilizing the matrix, but more important, it is placed below the gingiva cavo surface margin to prevent the amalgam from the flowing below the cavo surface margin. See the diagram. This one is correct one. This is incorrect. So correct to incorrect bed position. वेजिंग टेक्निक होती है अलग अलग. फर्स्ट वन है सिंगल वेज टेक्निक. में सिंगल वेज को अपन को कॉन्टेक्ट एरिया में रखना होता है. नेक्स्ट इज पिगी बैक टेक्निक, यूजफुल फॉर द पेशेंट विद द जिंजाइवा रिसेशन. wedge is significant particle of the gingiva margin. A second wedge may be placed on the top of the first. Third one is double wedging. one from lingual embrasure and one from facial embrasure. Only if middle two-thirds of proximal margin can be adequately wedged pressed. So when proximal box is wide and facial lingually, तब ये technique use होगी. Wedge wedging. Mostly employed on the mesial aspect of maxillary first premolar because of floated roots concavity. And second position is wedge is inserted between the first wedge and the band to wedge a matrix when tightly in such a margin. Thank you so much.